Hi class, I will be sharing with you my response for DQ6. Screening and assessment go hand in hand, however, they have two different functions. According to the text, a screening is to identify those patients who might have a certain disease or condition. It is a clinical interview to build an overview of the client's substance use patterns. Screenings can be conducted verbally or via pencil and paper, and it is short and specific. At the ends of the process, the assessor will be able to determine whether or not there is evidence of an SUD. The assessment process is more than a one-time paperwork procedure conducted at the onset of treatment to simply gather minimal facts and secure a diagnosis. It is the first step in the rehabilitation process, and it is ongoing throughout the life of the client's treatment. In the assessment phase, according to the test, in the assessment phase of the process, the assessor tries to determine the severity of the SUD. This includes checking for frequency of use or the quantity. The three formats for an assessment are structured, semi-structured, and unstructured. This is accomplished through clinical interviews, which include flexibility, establishment of rapport with the client, reassurance to the client's uncomfortable working with written tests or computers, and it all allows the therapist to watch the client's nonverbal behavior in response to questions. And it also identifies areas for subsequent exploration. The assessment could also include psychological test data to help identify the client's personality traits that might influence the severity of their SUD. Also, standardized testing, exploring past treatment and legal history, military records, educational vocational history, family history, developmental history, and psychiatric and medical history is included in this process of assessment. You know how to use when determining on overall what the client presents with. For example, the screening process is the initial stage of the treatment plan, and the assessment process is the one that is ongoing based on the client's needs and progression through treatment. Both are necessary and cannot stand alone as one method of meeting the need of the client. Again, the screening occurs in the beginning. That is to identify, like, hey, does this client show any signs of an SUD? And then if so, let's give this quick screening to determine if they do need further assessments. So the information gathered from the assessment is compiled and utilized to help the clinician determine what other services the client may need and how to proceed with the implementation of the treatment plan. So that is it for my response. Thank you.